thank you so much for joining me for a Corona conversation. For people who don't know you and don't know where you are in the world, could you just tell us who you are, what you do, and where you are in the world today?
Great. Yeah, thanks for having me on or speaking to me. Yeah, I live in South Africa. I've always lived in South Africa, and I've been involved in the sort of drug field for probably the last 20 years. Initially, as I call it as part of an embedded ethnographic study, but in reality as a drug user. And then after a while, I got involved in actually volunteering and helping out at a drug center. And pretty quickly I realized that the pursuit of abstinence wasn't making much sense in my setting at all. And so I started just creating a space for people to come to. And I thought I was rather brilliant. I thought I'd invented something new, but then I discovered harm reduction, which is supremely logical in our setting. You know, we were working with a population that was basically 60% of them were members of gangs. They were highly criminalized. They were living in sub-economic circumstances. We had high levels of psychosis, a lot of methamphetamine use, a lot of methaqualone use, which is old quaaludes, not much heroin use in those days. But I was seeing a lot of things happening that just didn't make much sense to me. You know, nobody was talking about dose response, for example, which we know for methamphetamine is really important, especially when you've got such pure methamphetamine. And nobody was talking about sleep and nutrition. And so these were the things that interested me. So I went back to varsity and I studied for a while. And when I was studying, I got more and more interested in this. And that's what I've been doing ever since, initially as a volunteer, then as a consultant. And
where are you in South Africa today? What part of South Africa?
Okay, so I work in three cities predominantly. I work in Cape Town, in Durban, and in Pretoria. But we have coverage in a number of other places as well. But those are the three main cities I work in. I've got an appointment at the Department of Family Medicine at the University of Pretoria, and I work with TB HIV care in Cape Town and Durban. And then I also started the network of people who use drugs in South Africa. So I chair that organization out of Cape Town, but we've got offices around the country.
So in terms of being able to talk to someone who can tell us what's going on the ground in South Africa today, we couldn't ask to talk to a better person. So
yeah, so I've got a team of people that support me, and yeah, so we work together quite closely. And it's Dr. Andrew Schreiber and then Julie and a number of other people as well who work together. So yeah, I have been sort of at the hub of it. Before I started, there was nobody doing any harm reduction or anything in the country, really. And now there are a few of us, and the word is spreading.
Okay, so just before I ask you questions about what the impact of Corona has been on vulnerable drug-using populations in South Africa, can you just very quickly confirm for me that the major drug issues in South Africa at the moment would be alcohol, cannabis, methamphetamine, and what else would be a problem?
So heroin, we've seen a large increase in heroin usage. Unfortunately, for a long time, people weren't reporting it as heroin. There were some really strange journal articles, actually, one of them in the Lancet Journal of Infectious Diseases, I think it was, that spoke about this new drug called Wunga or Niobe, and it contained apparently antiretrovirals, but that's just rumor and conjecture. In fact, it's heroin. And if people bothered to look at the Swahili words, they would know, for example, that it's, Unga means white and, or flower, sorry, and Niobe means white. So it is heroin. People are started off smoking it. We didn't have an injecting culture in South Africa really, but now we're seeing more and more sort of injecting taking place.
Okay, so the backdrop looks amazing, but actually that's not really where you are at the moment. Are you locked? Are you? Yeah, is Cape Town and Joburg? Are you on lockdown now in South Africa?
Yes, we are. The background's just a trick of the computer, so I've dropped another background in. But yes, I'm in Cape Town. I'm stuck at home at the moment. As somebody who's involved in health work, I could theoretically get out occasionally, but we're trying to keep as low a profile as possible. Obviously, we're still offering services where we can, but it's pretty challenging. There's a total lockdown, and it's going to be very, very strictly adhered to. And even for essential trips to the shops, people can't buy alcohol, for example. There's a total ban on alcohol sales for the next 21 days.
That strikes me as being an incredible public health response, given the fact that lots of people I've spoken to, their alcohol consumption is going up. Has the government done that because they were so concerned about people's alcohol escalating, or they thought being drunk would make you more irresponsible and you'd go out?
I think there's a combination. South Africa is an interesting space because when most people talk about decriminalization of drugs, they go to people, well, alcohol is theoretically more dangerous than whatever other drug. Therefore, would you advocate for banning alcohol? If you said that in South Africa, a lot of people would say yes, actually. So there is quite a lot of prejudice against high volume drinking. I think that's part of the history of the country, though. And we know that although 40% of South Africans don't drink alcohol regularly, we've got a very high consumption rate. So that means the rest of them are drinking quite a lot. And I think that the government basically made the decision not to sell alcohol for two reasons. One is to reduce the number of people who went out to clubs and were mixed and socialized over alcohol pre the shutdown. And then also during the shutdown, I think there was concerns about domestic violence, for example, which is a big issue in South Africa. And then also, just making people more irresponsible. The problem, of course, is that people that haven't been able to stock up, we know that rapid withdrawal or rapid cessation of consumption of alcohol can be life-threatening.
I was going to say, what response have they made for those people who are going to be in withdrawal?
Yeah, look, I've spoken about that on the radio, and I've written a letter to one of the deputy ministers here, and a couple of other people. I've tweeted about it. I don't know what they're going to do. One would think that there would be some way of dealing with that, because it's relatively simple. Maybe limit the number of hours that people can access alcohol, but certainly the majority of South Africans don't have enough money to if they've got an alcohol dependency, to stock up on enough alcohol for 21 days.
So has the ban led to either black market alcohol or an increase in homebrew, or people using meths or something else like that?
Well, that's interesting because we actually don't know, but a lot of people have been saying, oh, well, we're going back to the moonshine days. And of course, when people try and synthesize alcohol, we've got all sorts of problems, including them messing it up and producing methanol, which we've had a couple of times previously. And then the other thing is there things like hand sanitizers and that have alcohol in, and you don't know what people are going to do in desperation. We've heard these stories before, people trying to overcome, blockades or the effects of certain, aversive medications by drinking the alcohol, anything that's got alcohol in it, and it can be pretty dangerous.
But we're putting out a video next week, Shaun, actually, that gives people practical advice who may be alcohol dependent about how to reduce their alcohol in a safer way to help them try and manage withdrawal at home. But you're the first person I've spoken to that started the conversation with the world's most common drug, and I don't think that was really something that we'd contemplated anyone would do. I mean, they thought about closing the cannabis shops in the US and the Netherlands. They did that for 3 hours. There were queues outside, and the Netherlands and the American government have gone, well, it's essential medicine, so people can still go and get weed. Which brings me to my next question. South Africa decriminalized weed. Is there any supply issues there, or is the government doing anything with cannabis?
No, and in fact, the shops aren't even allowed to sell nicotine.
So you've got a bunch of people at the most stressful time that the world has ever seen, with no access to alcohol and no access to nicotine.
Exactly, and I'm waiting to see how that impacts. But I think that certainly there'll be some under-the-counter sales. In South Africa, we've already got problems with counterfeit cigarettes. I don't know if they're real problems or created problems by the industry saying, oh, you're branding your cigarettes as our cigarettes. But we've got a large number of illegally imported cigarettes in South Africa.
So can you still buy weed in South Africa?
Well, only, weed hasn't been easily available through shops and that at this stage, because that's still not legal to sell it via retail outlets or anything. So the only way to access weed is the same way that you would access anything else. Either you've got to grow your own weed, which the people that are doing that would still have access to that, but we know that there are limitations on that, and people have still been arrested for growing over certain quantities. Otherwise, you've got to go the same route as somebody buying heroin or buying methamphetamine or whatever, and go to a dealer, and the dealers aren't operating at the moment.
Okay, so then I guess the bit I was really interested in focusing on was, what's the government's response to help the most vulnerable and marginalised in society who have got chronic drug problems? Are they ramping up NSP? Are they opening up OST services? Are they providing housing, basic food?
Well, the problem is that we haven't been doing much for people before this. So I was involved in the very first public OST project in South Africa, or low threshold OST program. Otherwise, you could only access it through private doctors, which was just unaffordable to the majority of people. So a while back, we opened a program in Durban. It was unfortunately, we only had funding on the short term, which isn't great, but we managed to retain people, over 75% of people, for the full duration of the project. And we were hoping government would step in, but nobody stepped in. We got funding from the Global Fund and from CDC to do 2 pilot programs, and we've now got 2 small programs running, but those are only for people who inject drugs, which is counterproductive. Once again, this is the problem with big donor funds, is that they tell you who to fund or who to give services to. And I certainly wouldn't have started there in South Africa, certainly 5 years ago, because we didn't have a lot of injecting, and we're seeing more and more injecting now. So needle and syringe programs in the in the municipality of eThekwini, they've actually closed that program down. Now they're about to reopen it again, which we started a number of years ago. But in terms of the current shutdown, it's not very many people who are on OST, because OST methadone in South Africa is about 30 times the price of some places in the world, and certainly 10 times more than most places. It's not on the essential drug lists for maintenance purposes. It's not supplied by the public sector. The only place that we have got a substantial program is in the City of Tshwane, because the City of Tshwane have used public funds, or the city funds, to fund about 1,000 people on methadone, and that's ongoing. So we've extended the take-home doses to between 2 weeks and 30 days for everybody. That's the maximum we can in South Africa, because it's scheduled as a Schedule 5 drug here. In Cape Town, for the small cohort we've done exactly the same, and the same in, I think there's another cohort as well that's happened to in Johannesburg. But
so the majority of people who are using drugs at the moment aren't in treatment. So we can't look to the government to ramp up non-existent services. So it's falling on the community to try and figure things out for themselves.
Yeah, so exactly. So what I'm about to launch a website, hopefully later today, but kinds of messaging that we've been doing to people is talking about things like how they can find safer ways of assisting each other when they go into heavy withdrawals. We know from that great Magdalena Harris paper and Tim Rhodes paper on generous constraints how most of the diversion is actually kind of a philanthropic kind of diversion, with people trying to help partners and friends, and that's basically all people can do. Certainly people don't have enough money to stock up on heroin, and the shelters, we got some good news yesterday that in Cape Town, the one shelter is going to allow us to deliver needles and syringes still. In the City of Tshwane, we're looking at continuing services, but the problem is that with the shutdown, there's supposed to be a removal of street people into sort of old schools or buildings to house them, but we don't know where they're going to end up, and so you've got to go find these people, and that's the problem. It's going to be pretty awful when everybody's withdrawing at the same time.
Is there a concern that there might be displacement to prescription medication misuse, or maybe people getting drugs on the darknet? Is that a thing that happens much in South Africa at the moment? Prescription medication use, darknet drug use?
Well, look, there's a lot of use of, certainly in Africa, there's a lot of use of things like
tramadol.
Yeah, but the majority of that, quite frankly, isn't coming in through your formal markets. It's often illegally produced product put into very badly replicated tramadol boxes. In fact, I've seen heroin in capsules that looks like other opioids, pharmaceutical opioids, but it's not. It's heroin, and actually quite good quality heroin. If people were moving more towards the pharmaceutical drugs in some ways, that's a bit better because at least they know what dose they're getting. But in South Africa, to access pharmaceutical opioids is not easy. You've got a 400 rand cost to the doctor, and that. So we do see some diversion of things like Bronchia and those kind of cough mixtures, which are not a good idea because of the other constituents of them, and people are taking them in large volumes, especially younger people. Mm-hmm. So what we might see is some people trying to move towards the codeine-containing medications. But in South Africa, you've got to register for codeine. So it's not even the cough mixtures, they're supposed to write down your name and take your ID number because it's part of the codeine initiative.
It sounds like being someone with a problem drug use issue in South Africa at the best of times is really difficult. And now that difficulty has made life almost impossible with unknown consequences, weeks and months down the line. At the moment, how many cases have you got in South Africa? I mean, have you had many deaths? Where are you at?
So we've just had the first 2 deaths in Cape Town. And one was a 28-year-old, which is surprising, a healthy young woman. And we've just hit 1,000 cases. It's obviously going through that little exponential curve in that it was up until a couple of days ago, it was 200 cases. We've got 2 cures, or supposed cures as well. But overnight, it jumped 300 cases. So the governments are trying to keep it below 1,500. Some of the modelers worked out, but that was sort of like the kind of stage we're going to be in. But of course, when people are withdrawing from heroin, a lot of those symptoms look a bit like early stages or part of COVID as well. So now you're going to have heroin users put into wards with COVID patients. That will certainly take the infections across, and they're particularly vulnerable because of the respiratory issues and that. And just because of the immunity. So I think we're going to have a major problem amongst our using populations, and the homeless populations in particular as well. And there's a big overlap between dependent drug use and the homeless population, which in my mind is totally understandable, because when you're living in those crappy conditions, heroin makes a lot of sense for some people. And we don't really have a solution for the homeless people. In Cape Town, there are 10,000 homeless people living on the streets. And they've only got accommodation for about 1,000 of them. So I don't know what's going to happen there. What we've been training some teams, and unfortunately, I can't be as actively involved as I'd like to be because my wife's just finished with 6 months of chemo, and so it's very vulnerable to infection. So we just trying to be as careful as possible. But certainly, I'm coordinating a lot of efforts, and we've been doing some training and that. And this afternoon, I'll be on the phone, phoning various contacts in all the cities to find out what's happened with drug pricing, how are people coping, and we're launching this web page as well, where we hopefully will get a lot of feedback, and we've already recorded a number of videos and that which are going on there, so I'll share that with you at a later stage. It's not going to be very professional and that, but it's for the people, by the people kind of thing.
And if you can send us that website link, we'll make sure that goes up at the end of this video, Shaun.
I'd appreciate that. But yeah, we're tough people in South Africa in a lot of ways, and we've been through a lot. But I think that nobody's really prepared for this. Nobody knows what to do. But I think there's a lot of genuine sympathy and empathy with people who are struggling. When I did my interview last night on the radio, there wasn't a huge amount of backlash on it, which normally there is when I talk about drug-related stuff. And I'm just hoping that the community takes this as an opportunity of not only looking after themselves, but being responsible and looking after other people as well with other needs. And my only hope of a possible positive to come out of this is that perhaps we would have learned to physically distance and to wash our hands when appropriate and to sanitize, but we would have learned to be socially more integrated and socially more supportive of each other, and use technology for those kinds of things rather than just the usual banal stuff that we see.
It's been a very consistent message, is that within all the doom and gloom, there is an opportunity of realizing this is a great leveler. You know, it doesn't matter where you are in the world, money, no money, you know, this affects all of us. You know, clearly, if you've got a roof over your head and you've got food, that puts you ahead of the game. But you're right, I think there is a lot more genuine compassion and care out there. It's a bit of a shame it takes something like this for us to realize everyone's part of our community.
And it helps us realize that it's too late once the pandemic has hit, or whichever issue it has hit, you know, and we've got to start reconsidering criminalization, because I'm thinking of these poor people in jail at the moment. You know, the conditions are terrible here, and they're going to get worse. And once one person in a cell of 26 or 27 people have got it, which is designed, that cell's designed for 11 people maybe, it's spread. You can't really contain it. But what I've been saying to people is that suddenly we realize how fragile we all are, but we've got to realize that even though we're all fragile, some of us are a lot more vulnerable, and we've got to realize that and try and create a more equitable society as a whole. I hope we don't forget these lessons straight after the pandemics.
Absolutely.
If it goes.
Absolutely. Shaun, thank you so much for sharing just a snapshot of what's going on. I mean, it sounds very different to other things that we've heard, and it just sounds like you're at the beginning. So I'd really love to come back in 2 or 3 weeks' time and find out where things are. Until that time, I hope you stay safe, your wife stays safe, and and people pick up the phone and are responsive to the things that you're trying to do.
And a big shout out to all the teams out there, because they're really putting themselves at the front line all over the world, but in particular in the City of Tshwane, the COSUP team and the Step Up Project teams, and the people I work with. I've got absolute pride in the work that they're doing.
Wonderful. All right, mate. You take care of yourself, and
thank you.
I'll talk to you soon. Cheers, Shaun.
Great. Thanks.
Bye.
Thanks.
And so the question that you chose to ask, will it be better where we're going? And though the answer I don't know for a fact, still my heart is saying, oh yeah.
Still just taking it one day at a time. Still don't know what I'm trying to find. Really I don't mind, cause I'll be fine. Yeah, I'll be fine. Yeah. No longer focused on yesterday, and I don't care, the rest will say whatever they want, what's left to say, what's left to say. Cause I'm leaving all the pain that meaning, what I'm trying to say,
to be perfectly honest, this is a little trick on the computer, because I've got such a mess behind me. I just I took the first picture I came across, and this is actually the back garden of my boss at the University of Pretoria. It's his back garden. And I took this photo when I went for a walk there when I was last up there. So it's a trick of the trade.
Well, I'm super impressed. It looks amazing. So look, I really appreciate you taking the time. And I'll formally start it in just a moment. But just to give you a quick idea, this is born out of conversations I've had over the last week or so with people about the impact of Corona on communities, particularly really vulnerable drug-using communities in different countries. And what we want to do is offer a platform to people to share their experience, whether you're a frontline worker, policy, a doctor, or someone who's living through this, or someone who's using drugs. So we've done the UK, US, Mexico, Brazil, I've got Italy later, and then, and one thing I would really ask you, Shaun, is that if there are other people that you know within South Africa or in the wider region that you personally would like to interview to find out what's going on, and then send us that interview, we'll upload that. So we kind of want to link conversations so the network grows and more people are able to, learn from each other. That's kind of the idea.
Great, yes, I've got a couple of people that I've thought of already, and a couple of people very much on the front line of things. So I can do a couple of those interviews or get them done. Of course, our big problem here is we're under lockdown at the moment.
Yeah, the junior always wanna be the senior. I swear that the